Minister, perhaps maybe take us through how you as a department feel about these kinds of initiatives.
So we're very grateful for the partnership with PinkDrive, the screening of people who have any concern about possibility of cancer, so that they can be referred for treatment. It's useless if we're going to screen and they do the screening, they do the finding that somebody has early cancer. Because the key thing is to find it early, and then we must have the facilities to make sure that such patients can be treated.
That is Minister Joe Phaahla, the Health Minister, talking to us about some of the initiatives the department itself is trying to put in place to also support initiatives like the PinkDrive. Has really come out in their numbers to take up this opportunity to get free cancer screenings, which are being sponsored by the PinkDrive. Of course, the PinkDrive has been doing these screenings for over a decade now, and I am joined by the Deputy Health Minister, Mr. Sibongiseni Dlomo. Thank you so much for your time. Of course, it does seem as though that the Health Department supports this drive.
PinkDrive is doing what we were supposed to do anyway. But when they are here, we show our support. But there are other screening services that we are putting in here, HIV, TB. So we are coming in to want to say to them, thank you very much for identifying a place and many other places that we have been doing over the past 14 years, where you screen South Africans for detection of early cancers, especially the cancer of the breast.
You can have a mammogram done, which we know can cost up to 2,000 to 3,000 rand. And of course, we understand that the drive will be taking place in various other communities throughout the year.
Meeting with Nolene, it was an excitement for me because she will be helping me to make an impact in the communities that I serve, especially by this new machine that the PinkDrive has bought, which is one of the world-class machines, and we will definitely work and collaborate with yourselves.
PinkDrive has been doing this work over a long time, so we would like to write a scientific paper with PinkDrive on outcomes of breast cancer screening using the PinkDrive database.
I'm standing here and also pledging my support as a country medical director for South Africa, Pfizer, that we work together. Nolene spoke about collaboration, which is very critical. That's where we come in, because really it's our interest to have women breast cancer free or early detection so that their prognosis become much better and they live longer.
It's really amazing to be here today, seeing that we've been partnering with PinkDrive for so many years, in collaborating with them, raising awareness about early detection for breast cancer. So it's really exciting to see that they've launched these 3D machines that will actually help to detect early cancer.
And I think what PinkDrive does is really takes healthcare to where the patients are and really underserved communities, and where I think women are almost overlooked from a healthcare space. This is in terms of cervical cancer screening, in terms of breast cancer screening. It's such a great need to those patients who would not normally have access to the kind of quality of care and diagnostics which Nolene and a team through PinkDrive are providing access to.
Screening for breast cancer is absolutely critical. We need to promote a lot more of it. From our data, we find that only about 1 out of 3 to 5 ladies who need to have the mammograms done actually go for it. So events such as this that promote a lot of screening, we're fully supportive of it.
I think having a mobile facility such as this that can go into underserviced communities will make the world of difference. It's really, an intervention that is life-saving. And I think the best thing that we can do is try and find ways and means of ensuring that there are more of these to travel the length and breadth of the continent as well as the country.